Lake Victoria is East Africa's treasure. The lake can be seen from space as a dark jewel on the African continent, nestled at the intersection of Kenya, Uganda, and Tanzania. Known for her beauty and her bounty, Lake Victoria plays a vital role in the culture and economies of the surrounding countries. Health of people and the environment in the Lake Victoria Basin, or HoPE-LVB, is an integrated project working to improve the well-being of communities living in the Lake Victoria Basin by promoting reproductive health, environmental conservation, and sustainable livelihoods. Lake Victoria is the second largest freshwater lake in the world. The Lake Victoria Basin includes parts of 5 countries: Burundi, Kenya, Rwanda, Tanzania, and Uganda. Lake Victoria is the largest freshwater fishery in the world. In fact, Lake Victoria is the most important inland source of fish in all of Africa. Fish from the lake are a basis of employment, food, and income. The fish catch is worth up to $600 million annually. Through fishing, grazing, and agriculture, the bounty of the lake and surrounding land and forests has been the main source of livelihoods for the basin population for centuries. Among the world's richest centers of biodiversity, Lake Victoria is a symbol of the fertility and life-giving environment of Africa. The lake is our life and our children's future. But the Lake Victoria Basin faces great challenges. Growing economies, urbanization, migration, and a growing population threaten the health of the lake and surrounding ecosystem, and thus the people whose livelihoods depend on it. Environmental problems are threatening the abundance of the basin and the sustainability of our families. These problems include unsustainable fishing, poor sanitation infrastructure, deforestation, pollution, and poor agriculture and land use practices. Due to pollution and overfishing, invasive aquatic weeds now cover a large portion of the shoreline, and the lake contains large sections without any life. The loss of species and uninhabitable areas of the lake means that fewer fish are available for catching. In the last 50 years, as many as 200 species of fish in Lake Victoria have disappeared, endangering fishing livelihoods. Trees are being chopped for fuel at unsustainable rates, wetlands are being degraded or disappearing entirely, and farm and grazing land is eroding. Farming has increased as more households attempt to meet subsistence needs. But the growing number of households has led to plot fragmentation and deforestation, which in combination with drought have led to poor crop yields, endangering agricultural livelihoods. These problems affect the health and well-being of the over 40 million people who live in the Lake Victoria Basin. Due to gender-based inequities, women are disproportionately affected by the poor environment, healthcare, and infrastructure. Women have many pressures and responsibilities, including childbirth, childcare and caring for the sick, collecting water and firewood, and cooking. On top of these responsibilities, they have little decision-making power and depend on underdeveloped health systems. Women face many challenges in planning their families and have little say over their reproductive health. It is difficult for women to access quality health care. A woman must often travel a great distance in order to reach a health center, which is likely to be understaffed and without supplies. 1 out of every 3 women in the Lake Victoria Basin would like to postpone or avoid pregnancy, but are not using family planning. In the Lake Victoria Basin, women give birth to between 5 and 6 children on average. This high fertility, combined with people moving to the basin, means that the population is expected to double within the next 20 to 30 years, which contributes to cycles of poverty and poor health from which it is difficult to escape. An example of such a cycle is environmental change and the rapidly growing population both work to increase pressure on natural resources. Girls may have to spend increasing amounts of time finding water and firewood for the home. This may lead to girls missing school. Girls with little or no education are more likely to marry early. Early marriage leads to early childbearing, which involves health dangers for mother and child. lower decision-making ability in their homes, and higher lifetime fertility, which continues the cycle of high population growth. How can we make sure that the population and environment of the Lake Victoria Basin are healthy and protected? The Population Health and Environment Approach, or PHE. The PHE approach acknowledges and addresses the complex connection between humans, their health, and the environment. PHE initiatives use integrated approaches to improve access to health services, especially family planning and reproductive health, while helping communities to manage natural resources and conserve the critical ecosystems on which they depend. Remember this example? We can address many parts of this cycle with an integrated population health and environment approach. PHE is an approach used by health and environmental organizations throughout the region and the world. The dots on this map mark PHE projects conducted over the last several years. Here, in yellow, you can see that there are many PHE projects already underway in sub-Saharan Africa. Experiences from these projects have shown a population health environment approach often leads to improved participation of men in health and of women in natural resource management. Integrated projects can reach the most hard-to-reach populations. They can be more responsive to priority needs. They are cost-effective to implement and time-efficient for communities. In addition, family planning and conservation are often better received when they are packaged together. Now, what is HoPE-LVB? Health of People and the Environment in the Lake Victoria Basin, or HoPE-LVB, is an innovative project implemented by Pathfinder International, Conservation Through Public Health, Ecological Christian Organization, and Oceanala Friends of Lake Victoria. HoPE-LVB is an integrated project working to improve reproductive health and access to family planning, to improve livelihoods and community well-being and conservation of the natural environment. HoPE-LVB has project sites in Uganda, on Busi Island, Wachiso District, Jagusi Island, Mayuge District, and in Kenya, in Gwasi Division in Homa Bay County, and Rakwaro and Karachuonyo in Homa Bay County. The objectives of HoPE-LVB are: 1. To improve reproductive health and access to family planning services. 2. To increase community capacity to sustainably manage Lake Victoria Basin related ecosystem resources to improve livelihoods, environment, and well-being. And 3. To increase public and policymaker support for implementation of integrated PHE strategies. These objectives work together to improve women's lives, improving their health and growing their resources, and increasing their participation in household and community decisions. Helping couples choose the number of children they want and can care for can reduce the economic burden on families and the pressure on natural resources. HoPE-LVB works with both men and women so that men are more engaged in family planning and reproductive health, and women are better educated in sustainable livelihoods and natural resource management. HoPE-LVB works within existing systems, training and empowering existing community groups instead of building parallel structures, strengthening linkages between health facilities and community health workers and village health teams, bringing together the skills of beach management units and community health workers, and identifying local leaders as partners and champions. All participants are trained in PHE integration, building on the knowledge of community health workers and beach management units with information on reproductive health and family planning, sustainable agriculture and fisheries, and environmental conservation. The project establishes model households that exhibit positive behaviors such as practicing sustainable agriculture and resource planning, adopting alternative livelihoods instead of overfishing, prioritizing reproductive health care and family planning, and investing in clean water supply for drinking, cooking, and washing. Project beneficiaries learn how their supplies can be used for services in multiple sectors. For example, beach management units use their boat engines for sustainable fishing practices and patrolling for illegal fishing, as well as for transferring children and pregnant women from islands to the mainland in emergency situations. As these activities are implemented, we're focusing on documenting results and decision-making practices. In order to increase support for the project and for the population health and environment approach, key decision makers will learn about PHE integration from media spots, model households and local champions, and project staff presentations and site visits. HoPE-LVB is working with regional bodies including the Lake Victoria Basin Commission and various ministries to help them support the PHE approach in the basin. As success and lessons are documented, HoPE-LVB aims to provide a model for others to support, learn from, and adapt for communities throughout the Lake Victoria Basin. HoPE-LVB and the population health environment approach can have great benefits for their communities of the Lake Victoria Basin. The project is improving reproductive health and access to family planning and strengthening livelihoods, the natural environment, and community well-being. We invite you to learn more, join us in our work, and spread the word.